for pain, when we're talking about it, it's really critical. We can't always use the same pain scales in the medical environment. So we may not get the grimacing. We may not get a person who can communicate pain reliably. And I've also seen where we've had individuals who use like a picture exchange communicate pain reliably with their picture system, and it be discounted because it came through a picture system. So, as providers who are well trained in this, we really have to advocate to our colleagues to say this is robust and they are saying their pain. And if they were vocalizing that out loud, how would you treat them differently? So we really have to educate. But we really have to think about, does it, do you have a normal tolerance for pain, or does it seem to be high? And a lot of parents will be like, I'm not sure. And so then we can just ask a variety of questions to tease that out. So how do you know when they're uncomfortable? I don't. Okay. Have they ever had an injury that you think should cause discomfort? Yes. Okay. All right. And how did you know? Well, I saw it and they never told me. Okay. So they probably have a high pain tolerance. So that's what we'd call that. But it might just be that they didn't understand like how we kind of categorize. So having those conversations doesn't mean a family is not aware. It just means that they may not have actually had anybody ask them that before. And so if I have kids I work with who have had broken bones, but they were found haphazardly versus them showing or even limping, I know they have a high pain tolerance. And if they can tolerate that and walk on it and get by, then, I might even have the question of, do you experience pain and how is that safe? But the other thing is, if you do, how are you going to show that? So what we often see in high pain tolerance is they don't express low levels, and it's like a flip is switched. And I've had many autistic adults tell me, absolutely, who can vocalize can tell me, absolutely, my pain is that way. It doesn't even register in my system. And then when it does, I can't even articulate, and I lose the ability to kind of manage it well. And I need supports to help people understand what is going on with me, because they'll be like, they'll think it's a psychiatric condition when it's just pain. So really, really important that we kind of understand every person's pain-based behavior when we're dealing with severe behavior, so that we can try to tease out what is what. And then with that management, it really is about, if we don't have good communication skills and it's hard to see and we know they're going to have something pain-based, we really have to think about proactive pain management. So in a tonsillectomy, they'll give you pain management right after, but then they typically will dose mostly PRN based. If we have an autistic individual come in who gets a tonsillectomy, I'm usually conferring with the families and then recommending to the medical team that they actually proactively pain manage, if that makes sense with the family in terms of their pain profile. So we also want to think beyond the medication. Again, they might not ask for the things that are comforting from a sensory standpoint, but we want to offer normal kind of pain management that we would with other folks, to make sure that we're doing the things that would help and also destimulate the environment, because most people are much more sensory sensitive when they hurt.